First of all, I'm Pastor Dr. David Okeyo from Winners Chapel International, Kisumu. I know you didn't know that. The Lord is good, and all the times. So just to observe the protocol, and I want to really appreciate our representative for the CEO, Kenyatta Hospital, that is Madam Dr. Nyongesa. You've done very well to give us the first background for the importance of nutrition in care. And I like your passion for care. From that simple speech, we congratulate you for that. I want to also recognize the presence of Director of Nutrition Services in the country in charge of building capacities of nutritionists countrywide. And that is the main reason why Madam Veronica is here. So I'm here to give my first address, and before that, I'll do it in three forms. One, I would want to bring out clearly the regulatory framework when it comes to matters of nutrition. And secondly, I'll tell a story. First of all, I'll tell a story, and then I'll give you regulatory framework, and then I'll talk about the new protocol when it comes to nutrition service delivery in Kenya from the regulator's perspective. I just want to take you to the Nutritionists and Dietitians Act number 18 of 2007, which all of you know is an act that defines professionalism when it comes to matters of standards. And I want to read just two sections of that act, which has been ignored most of the time, but it's very important for us to set a good care background for our patients and clients. I'm talking about patients and clients because some are not patients, but they need our services. This institute was set up to determine and set a framework for the professional practice. That is you and I, and then set and enforce standards for professional practice and ethics in nutrition and dietetics as a profession. And then finally, it was set to enforce a program of quality assurance for nutrition and dietetics. That is why we always ensure that every service provider must be qualified, registered, and licensed, and has accountability for their service delivery. Now, I want to go to the story. I don't know if the technical people you have you put it up? I'd shared it with George. And if you don't have, I'll play it out. Ladies and gentlemen, nutrition is core. And I've told this to our ministry that without nutrition, there will be no effective care, even when it comes to medication. And one of the things that, and the story that I want to tell you is that just recently you've seen a trending clip. I don't know how many saw it, which was talking about Kenyatta National Hospital. And I want to challenge the Kenyatta for today. The clip said, somebody's mother died. And the man said, Kenyatta Hospital has killed my mother. And in his statement, as you'll see it is in-house now, he said very well that my mother went when she was okay, eating, talking, but came out dead. That's a challenge I want to give Kenyatta. And one of the statements he made, which I captured very well, is that a dietitian prescribed a diet for this patient, which was not executed. And finally, the postmortem revealed that his mother died due to lack of glucose. Sitati, if you have not seen that clip, I will give it to you. Immediately I saw that, I sent it straight to the PS Medical Services, Dr. Luga, and the statement he gave me was, how important is this? And I told him, you're a public officer, you know you are supposed to take care of medical services. It is as important as you have had it. And we exchanged a bit, because he's my village mate, so I know him very well. That is one. Immediately, I sent it to the CS. The second challenge is not only for Kenyatta. I got a clip from JOTRH, which is also equivalent in the category of National Hospital. Typical anemic dinner. It was cabbage and ugali. And straight away, I sent it to CS Dwale. And he asked me, where is this facility? I said, it is JOTRH. He was so sad about it. And I called JOTRH nutritionist, and he said, it is true. What is there is what is going on, but don't quote me. I will not tell you who the nutritionist was. What does it tell us? Nutrition is core, but it has not been given what it deserves in management of patient care. Now, I want to be very candid today. And now that we are starting with Kenyatta Hospital, which is a national teaching and referral hospital that is supposed to teach other hospitals. The nutrition, which is a core service delivery area in the healthcare, must be given priority. Now, for us at KNDI, we have set up what we call the Nutrition and Dietetics Professional Qualification and Competency Certification Policy and Scope of Practice. I know you don't know this document exists. It was launched 2 days ago, but it has been there. And we are going to become more serious about it. Now, what I want to say is that the understanding of nutrition in our clinical care service should be known by the typical service delivery ends classified in 4. Number 1, there's a service we call clinical nutrition. You all know about it. There is also clinical dietetics. And there is food service diet therapy. And then we have food science nutrition. Now, many times, many facilities believe that food science is for the industry. But who is behind parenteral feeds? Who is behind enteral feeds? Modification. It is not the nurse. It is not the pharmacist. These are foods. And therefore, a food scientist must be at the background of assessment of quality. For example, if Fresenius Kabbis, for what they have been known for in terms of parenteral feeds, when we are reviewing the protocol for acquisition and procurement, who is behind the assessment of that quality? Is a food scientist. So in a hospital facility, we have prescribed here, we need a clinical nutritionist. The focus is on diagnosis, assessment, and of course, the preliminary phase 1 of nutrition care process. Then this mantle is handed over to those who intervene. The dietitian who should interpret the diagnosis and come up with estimates. And then it should be passed to the food service diet therapist who works with the cataracts to ensure that the food coming from there meets what was prescribed for specialized cases. It has never been there. The nutritionist we have in the health facility is doing everything. So we are going to a state where you as a clinical nutritionist, the focus is diagnosis, which means you must look at assessment from holistic perspective. Number 1, assessment is not about anthropometry. We have anthropometric assessment, we also have social assessment, we have mental assessment, and we have what we call vital statistics, which purely comes on what the clinicians also do. That is why we have insisted when we are training that the skills lab must be there for all cadres to learn these preliminaries. After that, a dietitian should now interpret after referral that this person now, based on the diagnosis, requires this amount of calories, requires this amount, this category of supplementation. This one needs a psychiatric, this one needs a physician. Then from there, we go to the kitchen. So you cannot give an anemic patient cabbage and ugali. It must be in line with what was estimated by the dietitian. So this book, I will give you a copy, Shetati, today. I've given Madame Veronica. She is aware of it, but not in this published form. It has categorized all nutritionists we need. Clinical nutrition, clinical dietitian, food service diet therapy, food science nutritionist, public health nutritionist, and community nutritionist. And that one will go up to the schemes of service level. That's what I was telling Madam Veronica. The second thing, we have subspecialties, just like the medical doctors. We have critical care nutritionists. You are aware of that? We have oncology nutritionists. We have pediatric nutritionists. And not only that, we have holistic nutritionists. So when you go to public health, we also have sports nutritionists. So nutrition has subspecialties which must be recognized. Now for us here today, as you discuss your content of the new protocols and technologies that you use in service delivery, please remember the 4 subspecialties of nutritionists in a hospital facility. And Madam Sitati, because you are also in charge of capacity building program at ATRI in KNDI, this is the thing. The 4 must be in all our health facilities. And we must push for it. Madam Veronica is very much concerned about clinical nutrition. But today, I've told her the phase 1 of critical care process is the clinical nutrition. The phase 2, which is intervention and evaluation or monitoring, is clinical dietitian, food service diet therapy, and a food science nutritionist. Those 4 must be found in a national and referring hospitals. The document is here with what they are supposed to do as competencies. Also, we have what we call job description for each of those categories, including technologists, dietitian technologists, nutrition technology, and technicians. Now that I've said that, let me conclude. If we depend on medication alone, we will continue to kill patients. I want to be very candid on that. Killing patients. But if we put nutrition at the core center, supplementing medication, we will have patients come out when they are healthy, unlike today when they come out when they are unhealthy. They went when they're healthy, but they come out when they are unhealthy. We can't lie on this, and it is our role as nutritionists to demonstrate our competence and capacity to deliver that service so that the leaders in our facilities, particularly the physicians, can recognize nutritionists. And please stop shying away and running behind consultant, saying that you don't want to hear the terminologies. Very soon, you shall be going through clinical nutrition training for 1 year at KNDI. If you want, you can join, but this will be purely for those who are being admitted in nutrition. After graduating from the university, they will take 1 year clinical nutrition, 1 year food service diet therapy, examinable. So thank you very much. I'll leave you with this, but George didn't want to show the story. It was very sad, so don't show it. But I will also share with you the picture for JTRH, because we're not only doing for Kenyatta. It was seriously sad. And then finally, never tell a diabetic patient that you don't need sugar as a nutritionist. Never tell a diabetic patient that you don't need. That is old nutrition. And that is what the nutritionists are doing. I was told that I should not touch any sugar. Be specific on which type of sugar you are talking about. So a diabetic patient has full right to consume all the fruits. Don't say that it will shoot up. So study nutrition science and get the new knowledge, and we shall be serving Kenya in a great deal. I want to say this. God should bless Kenya, but nutrition must be at the core. Our PS, Public Health and State Department for Public Health, has already embraced nutrition, and I see her everywhere. She even became a champion for nutrition this year. Let us work together with her so that we can impress on her to improve our nutrition. Also PS medical service, but I am not very certain that he will do it, given the fight between the medical physicians and the nutritionist and the farmer. But if the common goal is the patient, then we will all bring their heads together and tell them, you need nutrition to be at the core of any health facility. So thank you very much. I will leave this with Madam Shitati, and you can go through it, even share it. It's only one copy, but you'll see the real content of what we require in service delivery, the categorized service delivery. So thank you very much. May God bless Kenya, and God bless nutritionists. Thank you.